Good morning. Carol Dixon with the Idaho Federation of Families for Children's Mental Health, and I want to welcome you to our March parent webinar. And I want to say thank you for those who are joining us today, and I apologize. I know that March was a little bit loopy in terms of we had it scheduled earlier in the week, changed the date, changed the topic. All important things that we are presenting, so we're glad that you are here today. The topic we had originally planned on person-centered planning. At some point in time, we do plan to loop back to that. So just kind of keep watching our promotions that we send out on our website, and you'll find out when that one's coming up. So this morning we have David Welsh, who is a program manager with Medicaid, and we also have Janet Heckey, who's the member of the Parent Network, and she's joined us on several occasions to kind of share in the discussion of topics that we're presenting. So our focus today is on how families are able to access the services through the new Youth Empowerment Services Program, which is the Children's Mental Health System of Care program that's new to Idaho. So it's really important information to understand kind of what are the steps that you're going to take to find out if your child is eligible, and then kind of what services are being offered. And again, the recognition that this is really specific to Medicaid and to what the Medicaid services are. The program, David will go in, and Janet will explain a little bit more in terms of it's not just Medicaid, it's larger than Medicaid. But again, the focus is on kind of the Medicaid services. So to let you know that we are recording this, it's going to be archived both on the Federation website. You will also begin finding any of the topics that are YES related on the Youth Empowerment Services website. And at some point in time, we will put that up so you can get the website address for that. We're hoping that this is going to be kind of the first in a couple different topics that are relevant to the YES program that we'll be presenting that parents will want information on. And we're hoping that it'll be kind of between now and July when some new services roll out, so we'll really be able to get that information out there to you all. And I'm also hoping time-wise that Janet's going to be able to talk briefly and give everybody a little information about the Parent Network. That's something that's kind of a statewide program of parents that are really engaged in participating in the development of YES, but also involved kind of locally and regionally in their areas and working with parents. And what other important things do I have to say? April and May, the next two topics that I'm really excited about. We have webinars. April is going to be juvenile justice with a parent, kind of having a conversation of what happens when your kid and your family gets involved in the juvenile justice system. And then similar in May, we'll be talking about child protective services. And again, a parent and staff member from both of those organizations. You also, looping back to this, is if you have any questions, please post them on the YouTube site. We will get those and we will bring those out to David and Janet so they can answer any specific questions you have to the material they're presenting. And with that, I'm going to turn it over to you all. David, thank you very much on short notice for joining us. I really appreciate it. And Janet, you're just like one of our steadfast ones that we always love when you come back. So thank you much. Glad y'all are here.
Thank you, Carol.
Absolutely. Thank you, Carol. So let's go ahead and get the presentation up on the screen. Again, my name is David Welsh with the Division of Medicaid. Very excited to be here with Janet, and I think that we'll have a great conversation today in regards to the Youth Empowerment Services Program and how Medicaid fits into that system of care. So we'll get the presentation up here, and we'll start off by looking at a visual here that's kind of a representative of how individuals will move through that Medicaid SED program. And again, starting with referrals. Referrals will be coming in from providers, self-referrals, other types of referrals such as medical care provider referrals. Individuals will go into an independent assessment process through Medicaid eligibility, have access to Medicaid services, and then ongoing treatment will be administered. So this is kind of a high-level visual of the Medicaid SED program and how that falls underneath that Youth Empowerment Services umbrella.
So David, with regards to the referral aspect of this, if a family is having some struggles with their child and they suspect that it may be something more than just maybe a neurotypical child's behaviors, in order to get a referral into the system, or order to even start getting some kind of an understanding of what's going on, what would you suggest for a family to do?
So my suggestion would be that if a parent has a concern in regards to their child, and it's a potential behavioral health concern, and they've maybe met with a medical practitioner or some type of medical physician, there doesn't need to be a more or less paper referral process. It would just be them picking up the phone and calling the independent assessor, which we'll talk more about, and then engaging with them and going through that process. So if anyone has the potential to seek behavioral health services, then they could initiate that process themselves. They don't need to have a medical practitioner, a behavioral health practitioner, or counselor initiate that for them. They can just help guide them to that independent assessment process, and then potentially be or have access to Medicaid eligibility and services.
So maybe starting with their physician, and just expressing the kind of concerns that they have, and then beyond that, being able to go through an assessment process.
That is correct. And if there's not the ability to easily access a medical practitioner or a behavioral health counselor, then they can go directly to the independent assessment process, even if they think that there is the potential need, just to reduce barriers. We don't want to have children, families going to other physicians. We can have them directly engage with that independent assessor as soon as they desire to do so, and start that process.
Okay. And I know we're going to cover that more going forward too as well. So.
All right. So moving on to the next slide, we're going to talk a little bit about some of the objectives that I would like to cover today. So again, Youth Empowerment Services is a very big initiative that the state of Idaho is taking on, and Medicaid is working diligently with our state partners to bring a system up that is again, first and foremost beneficial to the youth, children, and families in our communities. And again, we've have some specific parameters that have been developed that we're working toward ensuring that this system of care that we're building, these services that we're bringing up, are in line with, again, that plan. So some of the objectives I'd like to talk about today are the Medicaid SED program and kind of how that fits into the Youth Empowerment Services umbrella. The second item would be Medicaid authority, Medicaid eligibility, person-centered planning, the independent assessment process, access, how all those elements fit into access to Medicaid services, and then how you are going to maintain that access to those services.
Okay, we got a full plate today.
We do. It's a lot to talk about, and I think that we'll try to go through this, really slowly. Again, we're open to questions, so if you have any, please submit them, and we'll try to address them today. So moving on, we'll start off with Medicaid authority. So I wanted to touch on Medicaid authority because I think it's very important for everybody to understand how Medicaid is approaching some of these services and how we're going to be able to fund them. Some of the services that are outlined in the Jeff D. Settlement Agreement that we want to establish in Idaho are not traditionally funded by Medicaid. So there's services such as respite, which we'll talk a lot more about, that isn't something that you can usually pay for with Medicaid dollars without jumping through some particular red tape, so to speak. But some additional requirements are set forth by the federal government in order for us to utilize Medicaid dollars to fund services that are outside of what would be called a traditional state plan benefit. So Medicaid did a lot of research and tried to identify the best way to support this Youth Empowerment Services movement and program, and how we could really leverage federal dollars to pay for some of these services. And we ended up pursuing a 1915I state plan option. So this 1915I state plan option really allows us some additional flexibility with the federal dollars that we are able to obtain for Medicaid services. And here on the screen are three really important aspects of us choosing this 1915I state plan option. So the first thing that it allows us to do is to target a specific population that we can provide additional services to, and increase the federal poverty limit to provide access to Medicaid. So again, that targeted population is children with an SED that are under 18 years of age. So again, that's the target population. And once we're able to target that population, then we can again say, all right, so individuals who are independently verified as part of that targeted population can have access to Medicaid at a higher federal poverty level limit. So instead of being eligible just up to 185%, now we can set that bar at 300, and anyone or any families that are underneath that 300% of the federal poverty level can have access to Medicaid services if they are, again, meeting that SED criteria.
So David, let's talk about that for a second. It's a great thing, right, to be able to target a population and say, okay, now, previously children with SEDs that were 18 years of age or under didn't have access to Medicaid services if they were above, their family was above 185% of the federal poverty level.
Great.
Now this allows us to expand it up to 300% for those families. Do you know, like, in general, like what does it look like for a family of, maybe a family of 4 with a child with an SED? What does that 300% poverty level look like? Is that, because those incomes, they actually get pretty high, right?
They do,
and
absolutely.
Do you remember the numbers exactly? Or close?
That's a great question. I don't have the federal poverty level chart in front of me, but again, I just would like to reiterate, what you're saying, Janet, is that those income levels get pretty high, and there are also deductions that can be incorporated into, subtracted from that income to not help but really identify what the actual FPL percent or what that family is actually falling into on that scale. So I think that if I want to say that if there's a family with 6 children, that the income limit is close to $100,000, if not more. So again, depending on how many children you have in the home and what your income is, that will vary, or that will determine whether or not you're falling within that 300%. But we never want to discourage anyone from applying for Medicaid through this process, because we have a department within the Division of Medicaid or Self-Reliance, or the Idaho Department of Health and Welfare, that are experts with this and can really help everyone apply those deductions and ensure that they're really looking at the holistic view of the income of the family and seeing if they do qualify for Medicaid, either a traditional Medicaid under 185, or if they're above that 185 up to that 300%. So again, this is a great initiative, and it will allow individuals who were not previously eligible for Medicaid to qualify at that higher percent.
Well, it nearly doubles the income level for families, which is a great thing to be able to provide this kind of assistance and access.
Correct.
For this group of families that previously has not been able to access services. So.
And the third item that really helps support moving forward with this 1959 is the ability to fund services that are not traditionally funded through Medicaid. So respite is a good example of that service that is available today for individuals who are part of the Medicaid SED program, that we can draw down federal dollars to help pay for that service for folks that qualify for this program. So traditionally, respite has only been available through other avenues within the state and not payable through the Idaho Behavioral Health Plan, but it will be, or is available, January 1st of this year. And as individuals become part of this Medicaid SED program and have that independent assessment process completed and are SED, they'll become eligible for that service.
So as parents, you're going to want to watch going forward in this presentation. We'll end up talking a lot about respite and why that particular service is only accessed through this 1915I, which is, again, just as you think about it, think about the state plan of services, the ones that are traditionally funded under Medicaid. And then there's this expansion, this ability that through the 1915I, it sounds like you've been able to target a specific audience, which is the youth and children up to 18 years of age that have an SED, provide them access to all the Medicaid services, up to, if their income level of the family is up to 300% of the federal poverty level. And then again, you can utilize additional service, which in this case right now is respite, that we'll talk about further later, as a service that's in addition to the group of services that are traditionally allowed for anyone who has access to Medicaid under the state plan for SEDs, correct?
Correct.
Okay, great.
All right, so a little bit more about this Medicaid authority. So this 1915 I-State plan option is a great thing for states to be able to utilize to, again, pay for services above and beyond state plan benefits, expand the FPL, and target a population. Now, that being said, us choosing to do this 1959, there are some specific requirements that the federal government has us maintain. And two of the key things that I think will be most impactful to families in Idaho are going to be an independent assessment as well as person-centered planning. And I'm going to talk a little bit more about both of these elements, but from a high level, those are the two things that families will experience a change in the current Medicaid process. And these are, again, additional steps to access Medicaid services if you're qualifying above the traditional limit, or if you're trying to, if you're a current Medicaid member and you're just trying to access respite services.
So, David, these are two things, the independent assessment provider and the person-centered plan, that the federal government has said, if you're going to be, in order to be approved for 1915I waiver, that anyone who wants access to those 1915I services must have these two things. So it's just hoops that the federal government has said, you have to jump through these hoops in order to prove that you're not just willy-nilly giving access to anyone, correct?
That is correct.
Okay.
Yes. So continuing on with the Medicaid Authority, let's talk a little bit more about the independent assessment provider. So again, this is one of the requirements for individuals that are going to be coming through and accessing respite services or want to qualify at the higher federal poverty level. So the independent face-to-face assessment is a functional assessment as well as a diagnostic assessment. So there's the main role, I guess, of the independent assessment provider is to determine or confirm a diagnosis and conduct an annual reassessment of that diagnosis and functional impairment, which is coupled as SED.
So, David, why can't we just take our child to the provider that's been providing the assessment before?
Because so again, one of the requirements is that independent assessment provider, and if the current treatment provider is not considered as an independent provider, so therefore the screening that they have done, or the CDA comprehensive diagnostic assessment that has been completed, can be used and turned into that independent assessment provider that Medicaid has identified as Liberty Healthcare for a review and confirmation. So if there are already examinations done or evaluations, they can take that information and look at it and then support it. Or maybe if it's potentially old or there's been new developments with the child, they may have to complete a new clinical screening. But again, all of that collateral information can be obtained and brought forth and reviewed by the independent assessment provider, therefore potentially not having that family have to walk through that entire process again.
So it sounds like the federal government has just said, we don't necessarily trust the assessments that are out there in order to avoid having issues. We want somebody who's independent from the system, independent from the child, to make or confirm and assess a diagnosis or functional impairment for the child in order to have access to the service.
Correct. I think that it's not, I don't know if it's a matter of trust. I think it's just identifying one entity as the entity that's going and reviewing and confirming SED to ensure that it's being standardized and done in one way, therefore providing equal opportunity for all individuals in the state of Idaho.
So it's more a standardization that the federal government has said, you need to have one standard, and there's no way to standardize different doctors throughout the state. Correct. So they have one group that has one standard they apply across the boards.
That is correct, yeah.
Okay, good.
All right, so continuing on with Medicaid eligibility, Medicaid authority. So the person-centered plan will be that next element that we're going to talk about. That's a requirement for individuals coming through this 1959 state plan option and being identified as SED. So again, the person-centered plan is a great tool. I think it can be really incorporated well into or can help guide treatment planning from all aspects of care for that individual. And there's specific requirements or elements that need to be documented in that person-centered plan. And again, that is in the Code of Federal Regulations, and it's kind of Medicaid's Bible, so to speak, that we follow, and we have to adhere to all the different guidelines in CFR. So once that plan is developed from a holistic approach of all the services that are potentially needed or needed for that individual, that plan needs to then be submitted to Medicaid. And what Medicaid will do is review that plan and ensure that all of those different elements that need to be incorporated in the person-centered plan are documented there, and then they'll determine it to be met or not met. So, and we'll talk a little bit more about that process for the person-centered plan to be submitted to Medicaid and identified as meeting all those CFR requirements or not meeting, and then what happens with either of those situations.
So it sounds like from a family perspective, a person-centered plan could be a really valuable tool, because from if I heard you correctly, it sounds like it coordinates all the different individual treatment plans that we have from the various doctors and therapists and others who are treating our children, so that we're all working towards the same set of goals, and we don't have disparate entities or treatments actually providing maybe services that or working on goals that don't necessarily coordinate into one whole.
That is absolutely correct, and I think you put that very well. I think that person-centered plan is, again, that overarching vision, mission, so to speak, for that child, and it helps drive those individual treatment plans, whether it is with the different providers that they may be involved with. It really helps bring everybody together and make sure that there's a coordinated effort for that treatment.
And I think that's one of the things as a parent I know I've struggled with tremendously over the years is I have a provider here that's providing therapy, and a provider here that's providing a different kind of therapy, and the school, we have an IEP at the school or a 504 at the school, and it's always been up to me to make sure that we're all kind of headed in the same direction, and that's an overwhelming thing for a parent. So It's great now to have something that will help us coordinate and make sure that we're all thinking about the same things, because when one plan's done one month and another plan's done a different month, the things that were important to me this month, the crisis has changed and it's different here, and so I don't even realize that we're not necessarily coordinating everything. So
right, that person-centered planning process is a collaborative approach to guide the care for the child, and anyone can be involved in it. And we'll talk more about the people who probably should be involved in it, but again, it's that collaborative approach. We can have all of the providers that are involved in care for that individual collaborate and help build a plan for that individual.
That's one of the great things about this whole YES program, is that by having all of these different departments and agencies collaborating together and working with families, I really do think we're creating something that's moving the whole system forward. And it also shows in the flexibility that Medicaid had to pursue the 1915I to say,
correct,
this is something that we really want to be able to help a larger group of people, and this is how we do it.
Right. So some of the requirements of the person-centered plan are pertaining to when that plan needs to be updated. So the plan does need to be updated at a minimum of every 12 months. Or when the member requests the plan to be updated, or when there's a clinical need identified to ensure that, if something transpires with the child where there's an additional service that may be needed, then the person-centered planning team would come back together and update that plan to reflect the additional need, and then go through that process of submitting it to Medicaid again. Now, I would like to say that if there are crisis needs, obviously that plan does not need to be updated before services are accessed. So just to ensure that everyone knows that if you are currently Medicaid eligible, access to crisis services is you can have immediately. But again, if there are service needs, we would like to put them on the person-centered plan to ensure that holistic view of the treatment plan, and again, that coordinated effort and approach to care.
So if my child goes through a crisis, I can immediately access the services that I need to address that crisis. And then if through that crisis we discover that there are other longer-term needs or goals that we need to address, then we would update that person-centered plan to include those new goals or new service or support or whatever that was found to be needed in the crisis.
Correct.
Okay.
So let's begin talking a little bit about Medicaid eligibility. So who's going to be eligible for Medicaid? So obviously individuals are already eligible for Medicaid. So those current eligibility groups will still continue to be eligible for Medicaid. And then with this 1915I, we've kind of added a new little group of individuals that can become eligible. So those that have a confirmed SED by that independent assessment provider. Again, that SED is a qualifying diagnosis along with a functional impairment. And they're under 18 years of age and have an income less than or equal to 300% of that federal poverty level.
So when you talk about a qualifying diagnosis, can you describe that a little bit more in terms of like what?
I can do my best, Janet.
Okay.
I just would like to say I am not a clinician. I've been in healthcare for many years, and from an administrative perspective, operational perspective, but so clinical is not my background.
Right.
However, been in behavioral health for a long time. So when we say qualifying diagnoses, so if there is a diagnosis that is a behavioral health diagnosis, and there is a certain level of functional impairment, then the individual would potentially qualify for the Medicaid SED program. So that's the kind of the definition for SED as it is in Idaho code. It is a qualifying diagnosis and that functional impairment, and a comprehensive diagnostic assessment will determine that diagnosis, and then using that with a child and adolescent needs and strengths screening tool will determine the functional impairment, and the two of those will be utilized by Liberty Healthcare, our independent assessor, to determine Medicaid SED program eligibility.
Right. So when you're talking about a qualifying diagnosis, it's really a behavioral health diagnosis. I mean, obviously, a child who had, the flu isn't someone. We're not looking at things like that. I know that seems kind of juvenile, maybe, to make that point, but
that is
it is a qualifying behavioral health diagnosis, of which there are
lots of. Yes, that is correct.
Okay.
All right. So again, continuing on with Medicaid eligibility. So we want to talk about a little bit about the program benefits. So if someone is determined to be part of the Medicaid SED program, again, that independent assessment process, SED determination, they're under 300% of the federal poverty level, they're going to have certain services available to them. They will have all enhanced plan benefits. So those enhanced plan benefits include behavioral health services that are provided through the Idaho Behavioral Health Plan, medical services, as well as transportation services and dental services. And the additional benefit, again, of utilizing that 1959 state plan option is having access to respite, that service that isn't traditionally funded through Medicaid. And that is going to be provided through the Idaho Behavioral Health Plan. So those are the services that someone would have access to if they, again, meet SED by the independent assessment provider and are under 300% of FPL and are under 18 years of age.
So David, under this Medicaid SED program benefits, if a person currently has Medicaid, right, and they haven't gone through the independent assessment, the enhanced plan benefits that you list there, are those the exact same for that group and the group that qualify? The only difference being the respite is someone who currently has Medicaid who hasn't gone through the independent assessor wouldn't have access to the Medicaid respite.
That is correct.
But they have access to the whole series of state plan benefits.
That is correct. Yep. So there's a basic and an enhanced plan.
Okay.
So if someone already has Medicaid, they're already falling into one of those criteria. The behavioral health benefits for both of those are exactly the same.
Okay.
Respite, again, like you indicated, an individual that currently has Medicaid that hasn't gone through that independent assessment process, they would not be eligible for respite services.
Okay. And then is there a group? So what happens if you don't have, if you don't qualify? So say you're a family that makes over 300% of the federal poverty level. Is there anything being done to address those families?
So as of right now, Medicaid is working very diligently with our partners to bring up a Medicaid system that really helps, that really does align with Youth Empowerment Services program and the Jeff D. Settlement Agreement, the services that are outlined in Appendix C of that agreement. However, Medicaid does have some federal restrictions as to what they can and can't do. And as of right now, we are only able to push that federal poverty level up to 300%. So if someone does come into the system that is under 18 years of age and that does have an SED, what services would they have available to them? And again, Medicaid's working with our partners, the State Department of Education, Division of Medicaid, Juvenile Corrections, to identify how we can also, as a team, support those children as well if they have a need. And we have some ideas as to how we're going to be doing that. But right now, the services that they would have available to them would be through Children's Mental Health and the Division of Behavioral Health. And I would encourage anyone that falls in that category to reach out to their regional Children's Mental Health employees and to speak with them about what services that they have access to.
It'd be good to get them involved in the system as well, just so that they're aware that changes will be coming too, because this is a group of people that we're hoping to include in the YES program, but won't be necessarily included through Medicaid, which is what we're here to discuss today.
Okay. I agree. I think that it's very important that we continue to collaborate and identify how we can serve all of the children in Idaho who have a behavioral health need. So the independent assessment provider, again, who is that? That's Liberty Healthcare. So Liberty Healthcare, again, is that entity that has been designated as the independent assessment provider, and their role is to ensure applicants meet Medicaid SED criteria. So again, they're going to be either using pre-existing comprehensive diagnostic assessments, and they're going to be conducting a children and adolescent needs and strengths screening to determine that functional impairment. And those two tools, whether they are reviewing a CDA or whether they're performing the CDA with the CANs, will help determine whether this individual could potentially be part of the Medicaid SED program. Again, that is kind of the first step, because unless they're already Medicaid eligible when they're going through this step, they have to go through self-reliance to see if they then qualify up to that 300% FPL. But if they're already Medicaid eligible, then they don't have to go back and reapply for Medicaid. And we'll talk a little bit more about that here in a few moments.
So with regards to the independent assessment, again, you've got a family who has a child that has a known issue, right? They have a known mental health issue with their child.
Correct.
When they go through the assessment process, in order to either qualify under the 185 to 300% of the federal poverty level because they don't currently have Medicaid, or they want to access the agency respite, they can bring their current diagnostic exam.
That is correct.
And that diagnosis would then be confirmed by the independent assessor, or the independent assessor will conduct a diagnostic exam. But additionally, there is a new tool called the CANs, the Child and Adolescent Needs and Strengths, which is a great tool that helps us all discover the functional impairment, right? So the CANs is a very wide tool for families, and this is something that I think families need to know. We've talked about the CANs on previous webinars before, and so please do go back and look up some of that if you have a lot of questions on that. But just a brief overview would be helpful for families here, I think, to be able to know that a CANs is going to look at, I like visualizations, right? So I say it's kind of like rolling up the shingles on your house and looking at all of the aspects that affect a child's function, right? Like, do they have stable housing, and what so it talks about the strengths of the child, like does the child have a real proclivity for cooking or for drawing that could be used as some place that they can find an improvement in another area of their life. And what kinds of needs do they have? Does the child have anxiety that prevents them from being able to function well in a classroom situation or in an educational type of setting or any other? But it really talks about the whole picture of the child and the family. And this is the first time that we've had a tool that really allows a therapist who's treating a child to know all of the underlying things. I know for me, when my son was going through therapy and having issues, one of the questions I always had was, how does the fact that I have a daughter with an extreme developmental issue that has, a sleep disorder, behavior disorder, all these other things, how does that impact the behaviors and the things that my son are going through? And the great thing about this CANS is that it will help everyone understand that whole bigger picture, and provide some real functional information for the family. But it's an important thing, I think, for families to know that this is part of the tool that's going to be used when they go to this independent assessment.
Correct.
So.
Correct. Yeah, the CANS is a great tool that Idaho has recently adopted, and are working with our provider networks to transition children's care to utilize the CANS tool. And again, as Janet has indicated, it does identify strengths and needs, and again, using those areas of strength to address those areas of need and creating kind of a common platform for discussion with all practitioners involved in that child's care. It really helps, again, coordinate those efforts, as well as measure where that success is and where there's not success, so we can try different things to help address those areas of need. All right, so continuing on with that independent assessment, again, so we talked a little bit about some of the tools. Again, the setting of that independent assessment process will take place in the community, primarily in the child's home. That's where that independent assessment provider from Liberty Healthcare would come out to the home and have a face-to-face discussion with the child. The child does not have to be present for the entire screening. However, for that functional face-to-face CANS, it is preferable that they are there for a portion of that, if not all of it. But again, sometimes we know that it's hard to keep the child focused and answering questions, or maybe they're not engaged, or there's other factors that weigh into that. Therefore, a discussion with the parents or guardians would be appropriate.
Right, and part of the reason for that too is having to retell their story all the time sometimes can be re-traumatizing for a child. So if you do have, or your child does have, traumatic things in their past that you don't want discussed in front of them again, because it would re-traumatize them and be very triggering for them, those types of things can be discussed separately from the child being present. So David, what happens if I'm a family and I don't want people coming into my home? I don't want to do the assessment in my home. Is there an option for those families?
There is an option, and it can be conducted in the community, and we've been working with our regional offices to provide an area in office that we can have the independent assessment provider meet with the family and child. That would be an alternative to conducting that in the home.
So could they do it just like in a coffee shop if they wanted to meet in a coffee shop?
We actually really prefer that it's a area where it's a closed-in office, because there is going to be protected health information that will be discussed. Again, we're going to have a child there and an assessor, and we really want to try to ensure that assessor is focused on that family and ensuring that they're conducting that CDA, reviewing it, or conducting that CANS. And then their focus is really with the family. So we hope that those alternative locations, such as a Department of Health and Welfare office in that region, would be a good alternative if the family did not want that person coming into their home.
Okay.
All right, so with all that being said, we're going to start talking about how all of those different elements we just discussed fit into that Medicaid CD program under that Youth Empowerment Services umbrella. And I'd like to really kind of take two paths right now and talk about folks that are currently Medicaid eligible, as well as individuals that are not currently Medicaid eligible. So I think making that distinguishing those two different groupings will help guide families, providers, and just anyone who may have an interaction with a family with a potential behavioral health need, as to how they can direct them, or when, or if they'll know which way they need to go and which path they should pursue to try to obtain the behavioral health services that they potentially need. So, the first group I'd like to talk about are individuals that are currently Medicaid eligible. So the question is, why would someone that is already eligible for Medicaid want to go through that independent assessment process, want to go through the person-centered planning process? And the reason for that is they want respite services covered by Medicaid. So I want to talk a little bit more about this, and Janet can probably help me out here, but the only need at this point in time today for an individual that already has Medicaid to want to go through those additional steps with the independent assessment provider and the person-centered plan is if they want access to respite services. If they don't need respite, if they have other family and friends that can provide the respite that's needed for their family, then that's fine. They don't have to go through these additional steps, because what Medicaid is trying to do is incorporate as many services as we can into just our state plan benefit. So not just Medicaid SED program participants have access to those services that align with youth empowerment services, but they're available to all children that may potentially need them who are on Medicaid. So I really think, again, if distinguishing between current Medicaid and the not current Medicaid individuals will help individuals move through this Medicaid SED program and youth empowerment services system of care.
So, David, you talked about families who get respite through another family member or a neighbor, a friend, or whatever. There is a program that exists out there in our communities that's called voucher respite. And if you have already been accessing this, you know it's available regionally, so every region does it separately. And it's a funded service, not through Medicaid. The funds for these services sometimes run out, and there are many regions throughout the state right now that I understand that voucher respite has run out. But there are still some regions that do have it. So if you have identified somebody in your area that can provide respite for you, and you currently have Medicaid, you could go to your children's mental health office, regional office, and ask them about voucher respite services, whether it's currently available. The fiscal year runs July 1st to July 1st, so if there are no funds now, we don't have word yet if it's going to be refunded in the next year, but it is definitely worth checking with your children's mental health regional office about voucher respite now and again in July to see if it will be funded again. But then again, if you have someone that can provide that kind of respite for you, you don't need to go through this independent assessment process if you have Medicaid already, because you already have access to everything except the Medicaid-funded respite. And if you have respite in another area or you don't need respite, again, you wouldn't need to go through that independent assessment process.
Very true. And I would like to distinguish one difference between the voucher-based respite and then Medicaid paid respite. So Medicaid respite is agency-based. And when I say agency-based, I mean that respite is provided by a behavioral health agency in your community. Now, that being said, it doesn't mean that agency can't have a representative that takes 5 children to the park nearby and has a group respite for an hour while those children are being provided respite. And so there is group respite and individual respite. So depending on the agency, they may offer both, but again, it's agency-based respite, being that it's an employee of a behavioral health agency that's providing that respite, whether it be group or individual. And the respite that's provided through the Division of Behavioral Health and Children's Mental Health, they also provide group respite, but the voucher respite that Janet was referring to is more or less a voucher that a family receives, and then they can pay a neighbor potentially or a close family friend, relative, to provide that respite for their child. And that is not something that Medicaid can do. Therefore, the only, again, respite that Medicaid will be providing to individuals that are part of this Medicaid SED program is agency-based respite, individual and group.
And David, are there restrictions, limitations on how much respite a family can get in a year?
There are. The amount that an individual can obtain in a calendar year is 300 hours of respite.
Okay, thank you.
And every year they would have that renewed as long as they continue to be a part of that Medicaid SED program.
Right, and so they have to go through that assessment process and the person-centered planning process
Correct.
Annually in order to requalify for the new calendar year versus of respite.
That is correct.
Okay.
So now that we've talked about the first group being Medicaid eligible individuals, let's talk about individuals that are not currently Medicaid eligible and what would be the reason for them to go through the independent assessment process. And I think that answer is very clear, that if there's a potential need for behavioral health services, then we want all of those individuals to go directly to Liberty Healthcare and begin that independent assessment process. And I want to talk about this a little bit more because I think that we don't want to just send people to Medicaid eligibility and try to apply for Medicaid first. We really would like them to go through the independent assessment process first. Therefore, we're mitigating the fact or the chance of them having to go through self-reliance at Medicaid eligibility potentially twice, or being denied when because they were at 200% of that federal poverty level when they could have actually been qualified if they had have went through the independent assessment process first, have been identified as an SED potential eligible individual, and then had that higher federal poverty level applied to their Medicaid application. So if a family has the potential need for behavioral health services, then we strongly encourage them to take the child to Liberty Healthcare or call Liberty Healthcare and schedule an independent assessment in the community to begin that SED, Medicaid SED program eligibility process. And again, we'll talk a little bit more about how that process, what happens at that independent assessment process, and some of the links and referrals for them. But we really would encourage, if there's at all a potential need, let's go ahead and default and send the family or you as a parent, take your child and have them assessed by that independent assessment process.
So, David, so we've talked about the fact that if you currently have Medicaid and you don't need agency respite, there's no need for you to go through the independent assessment process. But there's really two reasons why you would want to go through the independent assessment process. And that's if you don't currently qualify for Medicaid, but your child does have a mental health issue that they would like to have addressed, you could potentially, going through the independent assessment will potentially qualify you. If you have the qualifying SED and functional impairment, then you would be eligible for Medicaid up to that expanded 100 or 300% of the federal poverty level. I'm sorry, I'm struggling, tripping over my tongue right now. But then you also have those kids who do currently have Medicaid, but don't have access to any kind of respite, and they would like to have access to agency respite. Those families as well would want to go through that independent assessment process, have the qualifying SED and functional impairment, and then they obviously already have Medicaid, so they're not going to have that part redone, but they would then have access to the person-centered planning and the agency respite.
That is correct.
Okay.
Yeah. All right, so let's talk a little bit more about some of the linkages. So when an individual engages with Liberty Healthcare, now whether they're a current Medicaid member or whether they're not a current Medicaid member, I'm going to continue with that theme throughout the presentation. What are some of the linkages, referrals, or things that are going to happen at that time of that independent assessment? So let's again talk more about the folks that are currently Medicaid eligible. So let's say that someone that already has Medicaid wants respite. They go to Liberty Healthcare to do the independent assessment process and are determined to be a child with SED. So that person, that child and family would be referred then to the Idaho Behavioral Health Plan. And in that Idaho Behavioral Health Plan are all of Medicaid's behavioral health services. So they will be able to, again, access those state plan benefits if they weren't already accessing them. They would also then be referred to the Division of Behavioral Health to begin that person-centered planning process. And then once that was completed, they would be able to then access those 1959 services such as respite. So if a individual is currently Medicaid eligible and is determined to not meet that SED criteria, they would just be referred back to the Idaho Behavioral Health Plan to access behavioral health services that are available under the state plan.
So David, do they have to, once they've been identified as having a functional impairment and severe emotional disturbance diagnosis, do they have to wait until the person-centered planning is completed before they can access agency respite? Or can they access that as soon as that functional impairment and SED has been confirmed?
So that's a very good question, and the Division of Medicaid has been working really closely with our authorities at CMS to ensure that we're applying the requirements appropriately to our system. And one of the clarifications that we will be making in the coming days is in regards to that very question. So an individual that goes through the independent assessment process and is determined to be SD and is under 300% and is under 18 years of age, so they're meeting all of that Medicaid SED program criteria,
right.
They would, at the time that they're determined to be Medicaid eligible, have access to our regular state plan behavioral health services, as well as other state plan benefits such as transportation, medical services, etc. Respite is a little bit different. So the federal government, CMS, has instructed us that we are not allowed to provide respite services to those individuals prior to the person-centered plan being developed, submitted to Medicaid, and approved. And we understand that this kind of is a little bit of a change in direction that we had previously given. However, we're working very quickly to try to send out an information release and really communicate that to everyone, that there is a little bit of a change. We know that this does impact some potential Medicaid members that are out there today, and we'll be working with them to transition and ensure that plan development. It won't be just kind of a clean break. It'll be definitely a transition period to comply with that requirement.
Okay.
All right, so we're talking about linkages again, and focusing on the individuals that are not currently Medicaid. So an applicant goes to the independent assessment process who is not Medicaid eligible, or excuse me, who is not currently Medicaid, and they are identified as having an SED. They would be referred directly to Medicaid's Self-Reliance to start the application process for Medicaid. Therefore, they could be considered for Medicaid up to that 300% of the federal poverty level.
And Self-Reliance is that branch or independent group that you said before has expertise in determining what deductions to the parent, to the income, would reduce their qualifying income, and whether or not they're actually going to meet that requirement for up to 300% of. That
is correct, yes.
Okay.
So, and just to speak to that eligibility process, that's always kind of been a question about how long that takes. And if Self-Reliance has the information that they need from the family at the time of the application, they can turn that around relatively quickly in 1 to 2 business days. So, however, that being said, if there's additional information needed that the family has to gather, that could prolong that application determination. However, if everything is together, and we do have some self-help material that will help guide you as to what you need for that application process, it can be done relatively quickly. Therefore, once that determination has been made and an individual is identified as being Medicaid eligible up to that 300%, they'll have immediate access to behavioral health services outlined in state plan.
And do you know where families could find that information that would tell them what they needed to have?
That information can be found on the Youth Empowerment Services website.
Okay.
So we can post some information out on the web and that points to that information.
So we'll find the direct link to that and put it up on the YouTube link later so that you all can come back and find that direct link, because I know Youth Empowerment Services website, there's an awful lot of information on that website. So it'll be helpful if we can find the exact link for you and put that in there.
Correct. So again, sticking with individuals that are not currently Medicaid, if they go through the independent assessment process and they are identified to not be SED, they still may have behavioral health needs. So that independent assessor, Liberty Healthcare, that individual will help them or try to provide some referrals, some links in the community that individual could potentially access. And they will also refer that individual to Medicaid Self-Reliance, because they may qualify under the traditional Medicaid federal poverty level, which is up to 185. So we, again, don't want to discourage them from going and applying for Medicaid. They may not, meet the Medicaid SED program criteria and qualify for respite services or be able to qualify up to the 300%, but they may be able to just get traditional state plan benefits, which would require a qualification of that up to 185% of the federal poverty level.
Okay.
All right, so continuing on with the Medicaid SED program, Liberty Healthcare will conduct that independent assessment. That CDA will again determine the diagnosis. Again, if there's one that's been conducted recently, they could just review that and identify and confirm that diagnosis that was previously established.
So parents will want, if you've had a clinical diagnosis for your child done in the past, particularly if it's a relatively recent one, you'll want to try and gather that information and have it available for the independent assessor, as it's far easier for them to confirm a diagnosis and be a much less intensive process for you.
Correct. And when the family's initially contacting Liberty Healthcare, Liberty will go over that process with them and identify or ask if there are any other evaluations, neuropsych evals, psych evals, CDAs that have been completed recently, and they'll ask the family to see if they could gather that information. Therefore, it could be considered as part of that determination process.
And you do have the right as a parent to call up the provider that provided that kind of assessment and to get a copy of it. Typically, they're going to want to mail it to you just because of the good old HIPAA rules and requirements. But as a parent, you can request that information be provided in a different way. You just have to confirm that you understand that receiving it by fax or receiving it by email isn't isn't HIPAA compliant, that there are privacy concerns there, and you're willing to waive those. And so long as you're willing to do that in writing, the provider should be willing to email or fax that to you if you prefer to receive it that way.
Correct. So again, that CDA will help establish that diagnosis, and then that CANS will determine the functional impairment, and the two of those utilized together will establish that SED determination.
So again, David, let's just talk just for a minute here about the CANS and this assessment process. How long can a family expect to the assessment to take?
It can take a few hours. I think right now the averages are probably around 3 to 4 hours for a child to be assessed, both with the CANS and the CDA.
So again, for parents, this is a good reason for you to be thinking ahead about this. If we're talking about a 4-hour assessment in your home and potentially going over things that are traumatic or triggering for your child, this is a planning process, right? Think about, okay, if I don't want my child there for the entire time, what am I going to have my child engaged in? Am I going to have a friend, a neighbor, a parent, somebody come and take my child into another room, or take my child out, or how am I going to do this? Because like I said, if you're talking about a 4-hour assessment, that's going to be exhausting for families. But it also can be very helpful, because never before have we had a time when somebody is sitting down and really listening to our whole story, getting a complete idea of what really is going on with our child. And that can be a huge process to go through emotionally and physically, but also somewhat healing, actually, at times, to be able to process things in a different way. But understand, as a parent, there is some processing that's involved in all of this, and so be prepared for that.
So I know we've been on for about 55 minutes here. I'm going to start picking up the pace just a little bit. I want to see if we had any questions that potentially have come in. So it looks like we have not had any questions.
Okay. So let's keep going.
All right, so we will continue on here, talking about the Medicaid SED program. So once that independent assessment process has been completed, Liberty will actually be mailing out a notice of decision to identifying whether or not the individual met that SED criteria or did not meet the SED criteria. And that that notice will go out from Liberty Healthcare and will go directly to the guardians of the child, and appeal rights will be enclosed. And so if you, as a parent, disagree with whatever decision Liberty Healthcare made, you obviously have your appeal rights and can pursue an appeal with the Department of Health and Welfare directly through Medicaid.
David, does Liberty have any personal contact with the family after the assessment, in terms of, like, if a child has a new diagnosis or something is that the family didn't know, that can be a really emotional time for the family too.
Correct.
Is that,
So,
are they just going to get a letter saying, oh, your child has bipolar disorder and qualifies, right? You're like, what?
So that's a good question, Janet. So what will happen after that independent assessment takes place is Liberty will be in contact with the family within 1 business day via phone. And then within 5 days, they'll receive the actual determination letter. So that is kind of how that progression will happen.
So they will have some kind of conversation with the family.
That is correct.
Okay.
All right. So moving on to the next slide here, still Medicaid SED program. So once that determination has been made, now keep in mind that all individuals who are not currently Medicaid, regardless of if they meet the SED criteria, are still going to be referred to as self-reliant. So I just want everybody to understand that, because again, they may qualify up to that 185%. So class members, or excuse me, Medicaid SED, if you have been identified as having SED by the independent assessor, you can qualify up to 300% of FPL. If you were not identified as having an SED, you could potentially qualify up to that 185%. Now, current Medicaid applicants, so that if you are already Medicaid eligible when you're going through that independent assessment process, you're not going to be referred to self-reliance to reapply for Medicaid, because you already have it. What will happen is Liberty will communicate with Medicaid directly to ensure that that individual is identified as having that SED, therefore being eligible for respite. So For the individuals that did not have Medicaid through that independent assessment process, after they go to Self-Reliance and apply for Medicaid, Self-Reliance will then issue a notice of decision whether or not they're qualified for Medicaid. And again, if those individuals are confirmed SED, they'll be up to the 300%. If they're not confirmed as SED, they'll be up to the 185. But Self-Reliance will send out a notice saying you were either eligible for Medicaid or not eligible for Medicaid. And again, appeal rights would be enclosed in those notices, and the applicant and family could pursue appeal with the Department of Health and Welfare if they would like to in regards to that decision. So once an individual has been determined as SED, and if they had Medicaid eligibility or if they didn't have Medicaid eligibility, those individuals are going to be contacted by the Division of Behavioral Health to begin the person-centered planning process. So the Division of Behavioral Health regional employees regional clinicians will be reaching out to schedule the initial visit with those families. DBH, or the Division of Behavioral Health, will ask them, they will ask them if they've been given a Medicaid eligibility yet, if they've been determined yet. They will also be able to verify that directly with Medicaid, because once that Medicaid eligibility has been determined, if they are eligible, then the Division of Behavioral Health would start pursuing that person-centered plan for those that are Medicaid eligible. If someone is identified as a SED but determined to not be Medicaid eligible, the Division of Behavioral Health would not pursue the person-centered planning process with that individual.
So David, there again, if a family has an independent assessment, say they had an independent assessment done on Monday, how long until they get the results of that independent assessment?
So they would be contacted by the independent assessor within 1 business day of completing the assessment. Mm-hmm. They would be sent the notice of decision within 5 days.
So potentially by the next Monday, they now have the notice of decision, and Medicaid has asked, or Self-Reliance has asked for their information. Mm-hmm. And if they provide that information, you said within two days. So potentially by Wednesday of the following week, you could be Medicaid eligible if you had all of your information for Self-Reliance ready to go. You're looking at maybe a week and a half from the assessment until when you know if you have Medicaid eligibility.
Correct, yeah. The eligibility process, again, can happen relatively quickly if all the information is available for Self-Reliance to make that determination. That independent assessment process can take, they're contacted the day after, and then they're mailed the notice of decision. However, once they apply for Medicaid at Self-Reliance and that determination happens, as soon as they are identified as being eligible, they can immediately access behavioral health services through the Idaho Behavioral Health Plan that are covered under the Idaho State Plan.
And anything else, if they needed to go to a doctor for any reason, or once
Correct.
that Medicaid eligibility has been done. But for families, just making sure that from the day that you're assessed, you're looking at about a week-long process to find out if you have a qualifying SED and functional impairment, and then you're looking at a minimum of maybe 2 days and longer if you don't have all the information, in order to determine if you're actually Medicaid eligible, and then you'll be contacted by the Department of Behavioral Health to begin this process.
Correct. And the Division of Behavioral Health may contact the individual prior to the Medicaid determination, but they can kind of be a point of reference, or they can help guide that family to, or give them the tools that they need to ensure that they're providing all of the necessary material to Self-Reliance to make that determination. And the individual can always reach directly out to Self-Reliance and identify what is needed, so that determination can be made.
Great.
So let's talk a little bit about the person-centered plan. So an individual has been identified as a part of the Medicaid SED program, being that they're SED and they're under the 300% FPL, under 18 years of age. The Division of Behavioral Health will begin working to develop the person-centered plan with approval and input from anyone that the family feels to be appropriate to participate in that plan. So again, this just speaks to if there is a neighbor that has a great relationship with a child, someone from a church, or a friend, a grandparent. It could be a juvenile probation officer that there's a good relationship with. There could be a lot of different types of folks that could participate in that plan development. And again, it is a way for everyone to really collaborate and create that holistic treatment approach for that individual and identify those areas of need. And the comprehensive diagnostic assessment that was performed at Liberty Healthcare, along with that CANS, will help inform those discussions, and there will be clinicians involved, therefore they could guide those treatment needs.
So again, that person-centered planning, though, needs to have on it the individual treatment plans from any provider that will be providing a Medicaid service to that child, so that they can ensure that the plans are coordinated, correct?
Correct. Yes, we want to identify all services, whether they are reimbursed by Medicaid or not. There may be services that are not paid by Medicaid that are appropriate for that child to engage in, and we would like to strongly encourage those plans to have, again, that holistic view of the treatment needs.
Like an IEP or a 504 plan through the school.
Yeah, correct.
Great.
So the goal for the Division of Behavioral Health to complete those plans with the family and any other individuals identified as folks that are appropriately placed on that team would be 30 days. So again, that 30-day time frame doesn't prohibit that Medicaid eligible individual from accessing behavioral health services during that plan development. Respite would be the only one that would have to wait until that plan has been finalized. Again, once the plan is completed, it is then submitted to Optum Idaho, which is Medicaid's agent for reviewing those plans to determine that all necessary requirements are outlined on those plans. So, again, once Optum Idaho reviews those plans, there could be two outcomes. So there could be a potential element that was missing from that plan that Optum identifies and then communicates back with the Division of Behavioral Health to say, hey, there was this one area that was not addressed, or there was something on the plan that was potentially inaccurate that didn't align with the CFR requirements. They would again communicate that directly to the Division of Behavioral Health. That plan facilitator at the Division of Behavioral Health would then work with that group that created the plan to address that one area and then resubmit that plan back to Optum to ensure that it met those specific requirements.
And just for clarification, David, Optum is not reviewing those individualized treatment plans or anything or the services or supports that are recommended as being approved or not approved. They're simply looking at the checklist of things that the federal government said, you need to ensure that you have this documented and this documented and this documented, and once they check off all those boxes, then they send it back as approved. They're not looking at a service and going, well, I don't really know if this is really the service you should have. Right?
That is accurate. Yes, they are just looking at those specific elements that are required for person-centered planning. So if a plan comes in and it is determined to meet all of those requirements, then what will happen is Optum will communicate that met status back to the Division of Behavioral Health. That Division of Behavioral Health plan facilitator will then distribute that plan to all of those individuals who were part of that plan development and say, okay, this plan is good to go. At that point, the providers that are involved in that individual's care would then submit service request forms for services that are prior authorized, or just start providing services if they haven't already done so that were outlined on the plan. And then they could also access respite services. So again, for those services, all services that are provided in the Idaho Behavioral Health Plan should meet medical necessity. So just to clearly indicate that, but for the services that are prior authorized, they will be looked at by Optum's utilization management staff to ensure that those services are medically necessary and appropriate for that child to have.
So that's the point at which Optum will review those services for prior authorization.
The clinical appropriateness, correct,
Yep.
yeah. But again, we have worked really closely with our partners at the Division of Behavioral Health to ensure that we're aligned from a clinical aspect, and there shouldn't be issues where we're kind of not seeing eye to eye. And if there potentially are, we'll collaborate and work together. And first and foremost, what we're trying to get at is really what's appropriate for the child. So, yeah.
Okay.
All right, so moving on to the next slide. So ongoing services. So once that person-centered plan has been completed, and sent to Optum and is identified as meeting all of the person-centered plan requirements set by CFR, that individual is going to engage in services. So let's say something happens and there is an additional service that needs to be added to that person-centered plan. So then that person-centered planning team would reconvene and update that plan and then resubmit it back through Optum to ensure that it meets all the requirements. And then the providers would send in service request forms or just start providing services that don't need to be prior authorized. So person-centered plan updates need to happen, again, at a minimum of 12 months. They'll probably happen more frequently than that. But again, the minimum set forth by CFR, Code of Federal Regulations, RCMS guidance is at a minimum of every 12 months. And again, it needs to be submitted and approved by Optum within that 12 months. So, and I want to talk a little bit about how the CANS helps really inform that person-centered plan. So the CANS has a little bit shorter criteria for completion. The CANS should be completed every 90 days, or when the member requests to have it completed, or when it's clinically appropriate. So really, this is kind of the more frequent touch point, which will help drive that person-centered plan to ensure that changes identified in the CANS are going to be represented in the person-centered plan. So again, the CANS will really help identify those times where there is a service that needs to be added to the person-centered plan. And I would like to say that if a service is already on the person-centered plan, but the CANS and the clinicians think, or the team, person-centered planning team thinks that, hey, maybe we should be accessing a few more hours of that service a week, that doesn't necessarily constitute a plan change, because you wouldn't be changing a service on the plan. You would really be just kind of increasing the utilization of that potential service. But again, we'll really leave that decision up to the clinicians on that team to determine when it is appropriate. If it were a new service to be added to the plan, obviously that needs to be updated and then sent through the process to verify requirements are met. But the clinicians will really help guide those modifications to the person-centered plan.
And the update to the CANS every 90 days, part of the reasoning for that is that it helps us see if the plan of attack that we made is showing results for the child, and not compliance or non-compliance, but actually, are we achieving? Are we moving in the right direction? And if not, is there something that's revealed there that we can tweak to help us figure out, right, maybe a slightly different approach that would help the child?
Right. So with that, what I'd like to just run over really quickly again, and there are a couple main points that I'd really like everyone to walk away with today. And again, going back to the currently Medicaid eligible and not currently Medicaid eligible. If you're already eligible for Medicaid, the only reason you would want to go through this independent assessment process and person-centered planning process is that you would like to obtain Medicaid-funded agency-based respite. If you don't need respite, then access the services you already have available today in the Idaho Behavioral Health Plan. If you are not currently Medicaid eligible and there are behavioral health concerns, go to the independent assessment process to try and identify yourself as or your child as SED, therefore potentially qualifying for Medicaid up to that 300% of the federal poverty level, and then accessing respite services. So those are really the two main points that I'd like everyone to ensure that they have a good understanding of. And again, if there are questions, we are all here to help you. Please reach out to us at the Federation, other parents, Division of Medicaid, Behavioral Health, State Department of Education. We're all very excited to be implementing this new program, and we think that it will really benefit the children and families here in Idaho. And I'm very excited again to be a part of this. And if you guys want to reach directly out to me, please feel free to do so.
Thank you, David, for that. And just really quickly, I wanted to go over a slight bit about what the Parent Network is all about. We're a group of parents that came together a couple of years ago. We all have children that have severe emotional disturbances, and we're working with the state on the redesign of the services and supports for children with mental health disorders in the state. There is an easy way to reach out to your regional parent network. We have parents across the state, and there's at least 2 parents in every region in the state that are a part of the parent network. And you can reach the parent network by emailing PN for parent network, region, so PNREGION, and then whatever region you're in. So I'm the parent 4 region representative, so PN region 4 At gmail.com will get me, and PN Region 7 will get the Region 7 representative. The same for any other region in the state. And we're all parents with lived experience. We're happy to help and support you in this process in any way that we can. So please feel free to reach out to us.
And I don't know if there are any questions, but if not, we thank everyone for joining us today and hope this can be a great resource in the future.
Yeah, it's a lot of information. And so for those that are watching, if you know somebody else that may be interested, definitely encourage them to watch it. Again, it's archived, or it will be archived on the Youth Empowerment Services website, also our Federation YouTube website, so it'll be there to go back to at the point in time that you need that information. Oh.
And we have a question.
Nope, I think he's just getting me on the camera.
We have a question.
Okay, we do have a question?
Yes.
Okay, so we've got a question coming, but also I think with this we would like to do, we're talking about kind of some like frequently asked questions. So feel free to send to the Federation any questions that you would like to see answered at some point in time, and we will post those with the archive webinar. And with Janet talking about regions in terms of being able to make that connection, if you don't know what region you're in, I'm just going to tell you to contact Janet at the PN Region 4. Let her know where in the state you are, and then she will help make that connection to you so you're with the right region. A lot of people are just like, I don't know, I know that I live in Coeur d'Alene or Idaho Falls or things like that. Janet will definitely make that connection for you if you're not sure where you are. Again, thank you for your information. Mike, can you tell me about our question?
Who do you contact if a step has been missed?
Oh, who do you contact if a step has been missed?
That I'm trying to, I guess I could be a good point of contact if a step has been missed. I'm trying to. The question is very broad, but I can probably be a good starting point to help guide the response and ensure that we're moving forward and there are no steps missed.
And what about the parent network at
PN Region, whatever region you're in, or reach out directly to me at pnregion4@gmail.com. I'm happy to do that. Do you have an email address or
Yes,
a way to contact you?
My email address is david.welsh, so david.welsh @dhw.idaho.gov. And those questions can be emailed directly to me. We also have a Youth Empowerment Services contact sheet that we can get on the Parent Network website or the Federation's website as well that we'll be posting. It has contact information for everyone, the Division of Behavioral Health, Medicaid. There are some generic emails that addresses that all questions can be forwarded to, as well as some 800 numbers.
There's also a complaint line. So if you feel like you've missed a step, there is a complaint line, and can we get that number and put it? We'll get that number and put it up. I know it's on the Youth Empowerment Services website as well, but sometimes searching that website when you're in crisis is not the easiest thing to do. So we'll get that and add that to the YouTube link here so that you all can find it here as well.
Yep, and also add the Federation to that list, because what we do a lot of times is if we can't answer your question, we definitely send you to the person that can or find that information and get back to you. So there's like multiple resources and points of contact, and that's kind of the benefit, I guess, of having so many people involved in this project.
Well, and please don't just sit there and be frustrated and feel like you're waiting or things aren't happening in the right timeline, or don't sit there and just be frustrated. Reach out to someone. This is a new set of services and supports, a new design of the whole system. And if we don't hear what's going wrong, we can't fix it. So please reach out to us and help us know where there are things that need to be fixed, because you'll save a lot of parents down the road the same trouble you're going through now.
Okay, with that, thank you very much. I really like this format. I really appreciate having a professional, David, come and bring the information, and then having a parent kind of help to make sure that the information is provided in a way that it makes sense to a lot of those out there that are hearing it for the first time, or where it's relevant to you, and understanding how it's applied. So with that, join us next month. Hopefully these guys will return, because there will be more information that continues to roll out. See you in April. Thanks.